Hello, I'm Shaheen Kazali. I'm going to take you through MARS Endo software, which is software developed by AI Med to help surgeons record their data and produce surgical notes at the same time, keep a database, have a dashboard. You'll see all parts of the software today. So let's dive right in. After you have, let's just clear this. Okay. After you have logged in, you'll see this screen. This is your profile, and if you click on here, you can access your profile, which also has your preferences. Here you can set up your hospitals, your team, everything. We'll go through this again in the end of the video, so please continue watching until the end so that you see how to set up your account. Say we've just done a transanal discoid excision and left endometrioma excision and let's say a hysterectomy. So we add new patient. You'll notice that at this stage, we're not taking any patient details. So just an identifying number, and we talk about what that identifying number should be later. But you can use your hospital number, for example. Let's say I just call this test. Add a patient. You'll see that patient will then appear here. Click on complete form, and you're presented with this screen, which is for endometriosis classification. In your account setup, you can choose which one of these three classification systems you want to start with. Whichever you choose will come first. So here I've chosen that I want to use Venus. If you're not familiar with Venus, there will be another video on that. It takes 2 minutes to understand it really. But just for the sake of this video, let's say that we have a 3 on the left adnexa, 2 pelvic sidewall, and a 2 uterosacral ligament. Let's say we had a deep nodule on the uterovesical fold, but not full thickness. We had some deep disease on the vagina, and we had a nodule, full thickness nodule, in the pouch Douglas rectum. On the right side, let's say 3, 2, and let's say right adnexa was normal. You will notice that as I change these, first of all, this will change, and it will show you in the Venus cross format, which this is your left adnexa, this is your right adnexa, this is your rectum, and this is the bladder. And then it also changes the Enzian and the AAGL automatically. So we'll carry on. We say, okay, this tube was not patent and this tube was patent. Again, you'll see that as I do that, the Enzian changes. If I've said that I had adnexa 2 or more, it will ask me about the size of the endometrioma, let's say 5 centimeters. Let's also say we had appendix involved. Again, you'll see here Enzian changes to F intestine. Proceed to Enzian. By the way, at any point, if you have see a bug, you have a suggestion, you have any trouble with the software, just click on report an issue. You can either just write text or you can take a screenshot, which is built in within report an issue. You've taken a screenshot, that goes to our team and we'll sort it out for you. Proceed to AAGL. You do need to go through all 3 tabs, but the second and the third tab should really be a 5-second job because we have pre-selected the things that you would need to put. So here we'll see that actually all of it is correct. Yes, superficial, yeah, that's fine. Actually bladder, there was less than 3 centimeters. Okay, so submit. As we submit, it takes us to the rest of the form. Setting and team, procedure performed, and findings. We'll go through all of that one by one. We choose these options based on your previous procedures. So if you have just done a procedure, we copy all of those information into this so that you don't need to do it again. If you need to change it, of course you change it. Let's say my anesthetist changed knife to skin, let's say 220, and we finished at 430. Okay, this part, pararectal space opened, etc., is only for people who are part of the BSGE database. Again, that is all set in your preferences page. And if you don't tick that in the preference page, you won't see these questions. If you have any comments, you put the comments here. Procedures performed, route of procedure, it's all self-explanatory. So let's say we did this robotically, and we did open Hassan technique, and we used 5 ports robotic. Okay, here is where you will say what procedure you did on each compartment. So let's say we removed the left tube, which was not patent. And as you change things here, you'll see at the bottom, the procedures that you chose will appear. So salpingectomy left appeared here. Let's say that I also removed the right salpings. It makes it salpingectomy bilateral. Okay, so we had a cyst on the left ovary, didn't we? Remember that the endometrioma is separate from the ovary. So we didn't remove the ovary, but I normally suspend the ovary. Let's say I suspended the left ovary and kept it. I excised the left endometrioma. I did a ureterolysis. I excised the left pelvic side wall. So you will see that as I do that, all of these will come down here. Excision of endometriosis will not change for the pelvic side wall and uterosacral ligament. Just for the sake of the argument, let's say we ablated the uterovesical fold. You see that ablation of endometriosis appeared here. Did we say we did a hysterectomy? Let's say we did a hysterectomy. And vagina, nothing. Rectum, we did a full thickness discoid excision. Okay, again, it comes down here. We excised this, did a ureterolysis on the right as well. And that's it. If you've done a procedure that doesn't appear here, let's say we've inserted, done what? Let's say we did something to the diaphragm. Okay, so you just, do this first and then search. As I put diaphragm, it will bring it here. Let's say excision of diaphragmatic endometriosis bilateral. Okay, it brings it here. And if there is anything else that you want to add, any comments, you put comments here. EUA, again, self-explanatory. Uterine size, let's say it was big. Some of these, the order will change. But now it's asking you about the nodules. So you see that the questions appear only relevant to the procedures that you've done. So because we said that we had a nodule and we did the discoid, it's asking me now how far was it from the anal verge, let's say 12 centimeters, and we had one nodule. Here you need to be careful. The default is usually on the left side, but that is selected. Nodule size, let's say we had a 3 centimeter. And each section, so findings, procedure details, each section will have its own comment section that will appear in the end in your operation notes. All of these are self-explanatory, and all of these you can change in your preference. Energy that you used, monopolar, scissors, and bipolar. And when you say other, a box will appear. You can say what else you used. Let's say plasma jet as well. The suspension material, if I've suspended the uterus with PDS, I write it here. Discoid resection technique, we use the stapler. It asks me what size the stapler was and how did I close the vagina, let's say continuous, how, with what material, barbed suture, and 2O. Bowel integrity, Michelin test, estimated blood loss 100, hemostatic agent. So all of it is self-explanatory. Here you put your plan for the ward. So again, you can change all of this in your preference and do whatever you normally do. So let's say we want to give 40 milligrams post-op for 7 days, catheter to take out tomorrow, blood test, full blood count, CRP, and discharge tomorrow if well. This part, don't worry about it. This is about the post-operative complications. Okay, so that is all we have in this section. I forgot to talk about the complications intraoperative. So if you click this, if there was a complication, we gave blood transfusion, we put it here, and we will have a section soon that you will then categorize these. Okay, so this is all done. Submit the form. Okay, as you submit the form, you'll see a download report will appear. Now, when you click on download report, it asks you for the patient's name. This is not recorded on the database. This is only to appear on the PDF that you will print out, and it will disappear. So you're not actually recording any patient details. Let's call the patient test John. Date of birth, 1st of the 1st, 1978. Download report, it goes to your download folder, and let me see if I can move this. Yeah, I can move it here. Yeah, so here you will see the name appearing here, the team, and when you see the team, you will also the team's specialty, which is again in the back background. The details of the classification systems and the details of your surgery, the instruments that you used, and the plan post-operatively. Okay, so now let's talk about the more exciting things. Here in the dashboard, you have this is real data, this is my data, and you can play with it any way you want. Here you have your volume. You can select a custom time period, and it changes everything for you. Okay, so you will see the procedures that you've done, the complexity of each procedure, and I say this is real data, but actually these numbers are not exactly right. The complexity, and when you hover, you can see the details, the numbers of each of these. The route of the procedure, the complications, all procedure complications, just endo or rectovaginal endo, and by rectovaginal endo we mean the ones that you did either shave, discoid full thickness, discoid partial thickness, or segmental resection. So here is the dashboard. Now, finally, let's go to the preferences. Here is where you can change all the names that will appear, all the instruments that you normally use, the post-op instructions you want to give, and also here, if you have anything that you always want to say in your post-operative note to the ward, to the GP, or to the patient. So for example, you may want to say, I don't know, sutures to be removed day 5 by the practice nurse for all patients if you use non-absorbable suture, for example. Or here, if you want to say to all your patients what to do if they develop a temperature or whatever else that you want to say. So these are static and they are there for all cases. Again, we're working on this so that you can also have conditional text. If I've done a hysterectomy, then say this to the patient. But let's just dig a little bit deeper into this. So the hospital, these two icons are very important. This icon brings up or hides the second line, which we call long. So for everything, you have a short and you have a long. Short is what appears on the form and you only see it. So for example, here I say Lister for short. I know what that means. But for the form, I want it to appear as HCA, the Lister Hospital, Chelsea, London. Okay, so that is the long version. This long version appears on the documents, on the PDF output, and this one is only for your benefit. If you press on this, it will not delete your previous data, but it just hides it from the form. So you won't see this option in your form anymore. Okay, so, and the same applies to all of these tabs. Here, for example, we have for the form a shortened version, but then a longer version that goes into the thing, and the specialty. The same with anesthetist. You can say, you know, a short name here and the long name here. The same applies for all of the others. Here is where you choose which classification system you want to appear first. Okay, if you want Enzian, AAGL, or Venus. If you're part of the BSGE database, you put this as on, and as more societies will start using it, we will be seeing other societies here as well. The same applies to the others. So again, a reminder that any problems, any issues, any bugs, you just click on here. It takes a screenshot if you want, and it immediately goes to us and we'll sort the problem out for you.